Hello and welcome to UroChannel. In this video, we're diving into a topic that affects many men, but is often not discussed openly: erectile dysfunction. I'm Stefan Buntrock, a board-certified urologist and sexologist. If you've done any research on this topic, you've probably found a lot of conflicting information. Much of it focuses on just managing the symptoms, and there's plenty of information from dubious sources. We have lots of this in Germany too. They advertise by the term sexual weakness. Love that one. However, what if we could look deeper at the root of causes to actually fix the problem? What if you could be the solution yourself? In this video, we are not just going to talk about the causes of erectile dysfunction. We will also explore natural and innovative ways to address it and improve your overall health. A common assumption is that low testosterone is the main cause of erectile dysfunction. But here's the thing. Some men with normal testosterone levels still experience it, and others with low testosterone don't. Testosterone replacement therapy probably has some benefits in men with low testosterone levels. But according to my experience and a recent Cochrane review, success is not certain when implementing this strategy. The review was released in January 2024 and included 43 studies looking at 11,419 participants. So what's really going on? One critical factor that often gets overlooked is a molecule called nitric oxide, or NO. Well, actually, it's a highly reactive gas. This gas is essential for maintaining overall health and proper physiological function. Nitric oxide is released from the inner layers of your blood vessels. This is crucial because it helps your blood vessels relax, which is key for maintaining an erection. The issue is that as we age, our body's ability to produce nitric oxide decreases. In fact, by the time we reach 40, it may have decreased significantly. Age is one of the reasons, but lifestyle is another. Overall inflammation is one of the main promoters of reduced NO. Western lifestyle is one of the major causes of overall inflammation. It's a vicious circle. Aging and lifestyle reduce nitric oxide, and reduced nitric oxide doesn't just affect your sexual health, it impacts your cardiovascular system and overall well-being. When we look at the physiology of erectile dysfunction, nitric oxide plays a central role. And the good news is that there are ways to boost your nitric oxide levels. This will not only improve erectile function, but your health in general. Let's begin with the foundation of any effective treatment plan: lifestyle changes. The importance of a healthy lifestyle cannot be overstated. Erectile function and overall well-being depend on it, because it reduces overall inflammation, among others. First and foremost, diet plays a crucial role. Foods rich in nitrates, such as beets, spinach, and kale, are excellent for naturally boosting nitric oxide levels in the body. Once again, nitric oxide is essential for achieving and maintaining an erection. Incorporating these nitrate-rich foods into your diet can provide a natural boost to your nitric oxide levels. For a quick and effective way to start your day, consider a smoothie that includes leafy greens like spinach and beets. Not only is it nutritious, but it also gives your nitric oxide levels a great boost right from the start. Adding a squeeze of lemon juice can further enhance the absorption of nitrates. It helps maximize their benefit. On the other hand, it's important to be mindful of factors that can lower nitric oxide levels. Excessive sugar and alcohol consumption can damage the lining of your blood vessels. Then your body will produce less nitric oxide. Then there is stress management. Chronic stress leads to elevated cortisol levels. Cortisol is a stress hormone that inhibits nitric oxide production. Therefore, learn relaxation techniques. Do them daily, such as deep breathing exercises, meditation, or simply spending time in nature. They help reduce stress and support better nitric oxide production. Sleep is another vital component of a healthy lifestyle that directly impacts nitric oxide levels. Poor sleep can significantly lower your nitric oxide production. Did you know that sleep disorders like sleep apnea are often linked to erectile dysfunction? In sleep apnea, you stop breathing during sleep, and the worst part is, you wouldn't know if you did, because you won't wake up. Sleep apnea leads to reduced oxygen levels in the blood and increased chemical stress. This stress can damage the endothelial cells that produce nitric oxide. Again, your erections are in danger. Prioritizing quality sleep can make a big difference. Here's how you do it. Follow a regular sleep schedule. Create a restful environment. Don't eat large meals before sleep. Don't drink alcohol before you go to sleep. Talk to your doctor about sleep apnea and get screened. It's easily done. It can make a big difference, not just for your sexual health, but for your overall well-being. Interestingly, there's also a link between fatty liver disease and reduced nitric oxide production. Non-alcoholic fatty liver disease, NAFLD, impairs nitric oxide production. Never heard of it? Then let me tell you, it's incredibly common. According to the American Liver Foundation, 1/4 of adults in the US have non-alcoholic fatty liver disease. It has nothing to do with alcohol. It is linked to lifestyle. Particularly at risk are people with obesity or the metabolic syndrome. The liver plays a crucial role in metabolizing arginine. This is an amino acid that is a precursor to nitric oxide. When the liver is compromised, it can lead to lower levels of nitric oxide. And then vascular issues arise and erectile dysfunction. Addressing fatty liver disease through diet, exercise, and weight management can therefore improve nitric oxide production. As a result, it helps restore erectile function. But I'm not gonna lie to you. You can do everything right, yet still see no results. The body is not a machine and there are many variables beyond our control. Sometimes it is not that easy that you do action A, which will guarantee a desired result B. Everybody is different in terms of body composition and genetics, which is impossible to change. You just have to work with what you've got. Therefore, it could be that you will need professional help in addition to the changes you have implemented to boost your nitric oxide. Regenerative therapies are the latest advancement in medicine. These treatments aim to restore function at the root level. They are tackling the cause of the problem. One of the most promising treatments is shockwave therapy, also known as ESWT. This non-invasive procedure uses low-intensity acoustic waves to improve blood flow to the penis. The idea is simple. By stimulating the formation of new blood vessels or angiogenesis, shockwave therapy can help restore natural erectile function. But more importantly, ESWT has been shown to increase nitric oxide production in the treated area. Shockwaves promote the release of nitric oxide from the endothelial cells. They enhance blood flow, activate stem cells, and improve nerve function. In other words, it's rejuvenation of the tissues. Shockwave therapy has been shown to be particularly effective in men with vascular erectile dysfunction. The treatment is painless, typically requires multiple sessions, and has the potential to provide long-lasting results by addressing the issue at its core. Another innovative treatment is platelet-rich plasma, or PRP therapy. This involves using your own blood. It uses centrifugation to concentrate the platelets of the blood sample. Plasma and platelets are then injected into the penile tissue. The platelets release growth factors that can help repair damaged tissues and enhance blood flow. PRP therapy is also known to stimulate nitric oxide production. It works by promoting the healing and regeneration of endothelial cells. As you may remember, these produce nitric oxide. This therapy is gaining popularity due to its regenerative properties. It's a natural treatment that harnesses your body's own healing mechanisms to improve erectile function. And because it uses your own blood, the risk of adverse reactions is minimal. These advanced therapies offer promising results, no doubt about that. However, it's important to remember that they work best when supported by a healthy lifestyle. The combination of lifestyle changes, shockwave therapy, and PRP therapy can provide a comprehensive approach to treating erectile dysfunction. If you found this information helpful, I've got another video you should check out. It's about physical exercises you can do for a healthier lifestyle. You can find it right here. If you have any questions or topics you would like me to cover, feel free to leave a comment below. Don't forget to like, share, and subscribe for more content on improving your urogenital health. Thanks for watching. Bye-bye.